The global public health landscape is facing a renewed period of scrutiny as reports emerge regarding a shift in protocol at major international transit hubs. The implementation of a new regime involving mandatory masking in airports has been linked to concerns surrounding the hantavirus, a group of viruses primarily carried by rodents. While the headline suggests a high level of urgency, a factual analysis of hantavirus reveals a complex zoonotic threat that health agencies have monitored for decades. This group of viruses belongs to the Bunyaviridae family and is typically transmitted to humans through contact with the urine, feces, or saliva of infected rodents. The shift toward masking in high-traffic areas like airports represents an aggressive application of the precautionary principle, aiming to mitigate the risk of aerosolized transmission in environments where environmental factors and international travel intersect. Understanding the gravity of these measures requires a look at the two primary clinical manifestations of the virus. In the Americas, the focus is largely on hantavirus pulmonary syndrome, a severe respiratory disease that can progress rapidly to respiratory failure. In Europe and Asia, the virus more commonly manifests as hemorrhagic fever with Raynaud syndrome. Both conditions are characterized by high mortality rates and a lack of specific, widely available antiviral treatments, which explains why health officials prioritize prevention and containment. The decision to mandate masks in airports suggests a concern that transit facilities, large, complex structures often bordering diverse ecological zones, could potentially host rodent reservoirs or become points of exposure if hygiene standards are not rigorously maintained. Unlike more common respiratory viruses, hantavirus is not generally known for efficient person-to-person transmission, with the notable exception of the Andes virus strain in South America. Therefore, the focus of these new airport regulations is likely centered on preventing the inhalation of dust or particles contaminated with viral matter. For travelers and the general public, the primary takeaway is a heightened state of surveillance as authorities attempt to stay ahead of a pathogen that remains unpredictable in its movement from animal populations to human hosts. The core of the current public health response involves a multi-layered approach to surveillance, laboratory testing, and the management of logistics within the travel industry. National and international health agencies, such as the Centers for Disease Control and Prevention and the World Health Organization, maintain extensive networks to track rodent populations and viral prevalence. When a hantavirus concern is elevated to the level of airport mandates, it triggers a specialized diagnostic and reporting chain. Clinical laboratories utilize a variety of techniques to confirm the presence of the virus, including enzyme-linked immunosorbent assays, or ELISA, to detect specific IgM and IgG antibodies. Additionally, molecular testing through reverse transcription polymerase chain reaction, or RT-PCR, is used to identify viral RNA in patient samples. These technical hurdles mean that confirming a hantavirus case is a precision-oriented process that cannot be handled by standard rapid tests used for more common ailments. In the context of airports and shipping, the logistics of prevention involve rigorous integrated pest management. Facilities must be audited for structural integrity to prevent rodent ingress, and cleaning protocols must be adapted to avoid stirring up dust. The use of masks in these settings serves as a barrier against the inhalation of microscopic particles that may carry the virus. Officials often contrast the confirmed data, which shows that hantavirus outbreaks are typically sporadic and localized, with the need for broad-spectrum security in hubs that move millions of people. While the source points to a new regime of masking, the underlying scientific reality remains focused on environmental control. Shipping and trade logistics are also impacted, as containers and warehouses must undergo more frequent inspections to ensure they are not inadvertently transporting infected rodents or contaminated materials across borders. This administrative and logistical burden reflects the high stakes of managing a pathogen with a significant case fatality rate, even when the overall number of cases remains relatively low compared to seasonal respiratory infections. The disparity between public alarm and laboratory-verified data is a common challenge for health communicators. who must balance the need for public cooperation with the reality of a zoonotic threat that is fundamentally different from a pandemic flu or a coronavirus. Prevention and public guidance remain the most effective tools in the management of hantavirus, especially given the current limits of medical intervention. There is currently no vaccine approved for general use against hantavirus in many Western countries, and treatment is primarily supportive, often requiring intensive care and mechanical ventilation for those with severe pulmonary involvement. Consequently, health authorities emphasize the importance of avoiding contact with rodents and their nesting sites. In the specific context of airport mandates and public transit, the guidance focuses on the use of personal protective equipment, such as high filtration masks, which are effective at blocking the aerosolized droplets that serve as the primary route of infection. For the general traveler, prevention also means practicing high levels of hand hygiene and being aware of their surroundings in areas where rodent activity might be present. Public health surveillance continues to face honest limits of knowledge. Scientists are still working to understand why certain years see a spike in rodent populations, often referred to as mast years, and how climate change might be shifting the geographic range of various hantavirus strains. The uncertainty surrounding these environmental factors necessitates a cautious approach to public policy. Looking ahead, the international community is likely to see continued investment in biosafety labs and field research to better predict and prevent the spillover of viruses from wildlife to humans. As these new airport regimes are implemented, they serve as a reminder of the ongoing struggle to manage the interface between human civilization and the natural world. Health officials urge the public to remain calm and follow the directives of local and international agencies, as these measures are designed to minimize the risk of a rare but serious health event. While the terror described in some reports may be an overstatement of the immediate risk to the average individual, the biological severity of the hantavirus justifies a high level of institutional vigilance. Continuous monitoring and transparent communication will be essential as the situation evolves and new data becomes available. For more updates on global health reporting and surveillance developments, consider following our ongoing coverage. The operationalization of these new health protocols involves a complex coordination between airport authorities, civil aviation ministries, and national health departments. When a directive for mandatory masking is issued in response to a viral threat like hantavirus, it sets into motion a series of logistical and clinical responses designed to harden infrastructure against zoonotic spillover. Central to this response is the role of specialized diagnostic laboratories and the specific mechanisms of viral detection. Because hantavirus symptoms, such as high fever, muscle aches, and profound fatigue, closely mimic more common respiratory illnesses or seasonal influenza in their early stages, clinical suspicion must be confirmed through rigorous laboratory analysis. This process typically involves the use of enzyme-linked immunosorbent assays to detect specific IgM and IgG antibodies, as well as reverse transcription polymerase chain reaction to identify viral RNA in patient samples. These tests are not conducted in standard outpatient clinics. They require specialized facilities, often operating at high biosafety levels, to handle these high-risk pathogens securely. This diagnostic lag time means that public health officials must often act on the basis of surveillance data from animal populations rather than waiting for human clusters to appear. In many regions, this involves sentinel programs where rodents are trapped and tested for viral prevalence in specific ecological zones. If surveillance indicates a spike in the number of infected rodents near urban centers or major transportation hubs, authorities may preemptively escalate hygiene requirements for public spaces. The logistical challenge at an international airport is unique due to the sheer volume of air exchange and the presence of hidden infrastructure, such as utility tunnels and ventilation shafts, where rodents might find harborage. While the primary mode of transmission for hantavirus is the inhalation of aerosolized particles from rodent excreta, the specific risk in a modern terminal is generally considered lower compared to rural, agricultural, or derelict settings. However, The mandate for masking represents a strategic attempt to minimize any potential for airborne exposure in large, shared indoor environments. This move often faces scrutiny regarding its proportionality to the actual risk. Health analysts point out that while hantaviruses are significantly more lethal than common respiratory viruses, with some strains carrying a case fatality rate exceeding 30%, they do not traditionally spread through person-to-person contact, with the notable exception of the Andes virus strain. Therefore, the implementation of masking in transit hubs is often interpreted by virologists as an environmental safeguard against the inhalation of contaminated dust rather than a measure against human-to-human contagion. This distinction is critical for public understanding. The focus is on the environment as the source of the pathogen. Beyond the passenger terminals, the shipping and logistics industry must also adapt, with increased requirements for pest-free certifications for cargo containers and storage warehouses. This ensures that the global supply chain does not become a vector for the virus or its rodent hosts. As agencies continue to monitor the situation, the emphasis remains on data-driven policy and the verification of reports. In statements from regional health bureaus, the priority is consistently placed on environmental remediation, sealing entry points, improving professional sanitation protocols, and ensuring that air filtration systems are maintained to peak efficiency. These measures, while less visible than a mask mandate, form the technical backbone of the public health response to a pathogen that thrives in the intersections between human development and wildlife habitats. The transition towards specialized health protocols in transit hubs highlights a broader strategy of prevention and surveillance that extends from the individual traveler to the level of national infrastructure. Public health guidance regarding hantavirus is fundamentally centered on the interruption of viral transmission pathways, which primarily occur through the inhalation of aerosolized particles from rodent excreta. To achieve this in a domestic or industrial setting, experts emphasize a rigorous approach to environmental hygiene that avoids the disturbance of potentially contaminated dust. Practical takeaways for the public include the implementation of wet cleaning methods, where surfaces are thoroughly soaked with a disinfectant, typically a solution of 1 part bleach to 9 parts water, before any cleaning begins.
This step is vital
because standard dry sweeping or vacuuming can launch viral particles into the air, where they can remain suspended and easily inhaled. For those in areas with known rodent activity, the use of high-efficiency particulate air masks or N95-rated respirators is recommended to provide a physical barrier against these microscopic threats. On a structural level, integrated pest management involves sealing every entry point into a building that is larger than 1/4 of an inch, often using durable materials like steel wool or metal flashing that rodents cannot chew through. These localized efforts are mirrored by large-scale institutional surveillance programs that monitor ecological shifts, such as heavy rainfall or mild winters, which can lead to a surge in rodent populations and a subsequent increase in the risk of viral spillover to humans. The implementation of mask mandates in airports, as reported in the current developments, reflects a high-stakes application of these preventive principles within the global travel network. While the risk of person-to-person transmission remains extremely low for most strains of hantavirus, the decision to require masks in high-traffic terminals is a measure of institutional caution. This strategy is designed to protect travelers from environmental exposure in large-scale facilities where total rodent exclusion is a constant logistical challenge. However, public health experts also acknowledge the honest limits of current scientific knowledge. There is no widely available vaccine for hantaviruses in many regions, and medical treatment remains largely supportive, focused on maintaining oxygen levels and managing fluid balance in intensive care settings. This lack of a definitive cure places a heavy burden on surveillance systems to detect outbreaks before they escalate. Scientists continue to study the long-term impacts of climate change on the geographic distribution of host species, as shifting weather patterns can drive infected rodents into closer proximity with human populations. This unpredictability necessitates a flexible and rapid response system, though it also raises ethical questions regarding the balance between public safety mandates and the disruption of international travel. As the international community navigates these new regimes of health security, the ethical imperative for authorities remains the transparent and accurate communication of risk. The characterization of these measures as a response to terror must be weighed against the scientific reality of a manageable, though severe, zoonotic threat. Public health officials advocate for a calm, evidence-based approach, urging citizens to follow official directives while maintaining a realistic understanding of the virus's transmission dynamics. The goal of these heightened surveillance and masking protocols is not to incite panic, but to ensure that the infrastructure of global commerce remains resilient against a pathogen that has a high clinical impact despite its relatively low frequency of occurrence. By focusing on environmental remediation, rigorous testing, and personal protective measures, agencies aim to contain the threat at its source. As global transit continues to evolve, the lessons learned from the current hantavirus response will likely inform future strategies